Hi, this is Dr. DocAmitay, registered clinical psychologist. One of the greatest controversies in the field of psychology, psychiatry, mental health is the use of medication to treat various mental disorders or other conditions. And I want to be very clear here. I do believe there are certain issues, such as schizophrenia, bipolar disorder, which we used to call manic depression, severe depression to the point that someone can't get out of bed, for example, suicidality, severe anxiety to the point that the person can barely even function in any area of their life, and so on. I do believe that for these types of issues, medication is warranted. I'm not anti-medication. My concern is, and this is a cliche, but it's been going on for years and years at the same pace, basically, it seems, it's that too many patients are seeking medicine for things that really either don't require it or aren't being helped by it, or maybe they're even being harmed by it. And too many doctors, not all doctors, but mostly family doctors, general practitioners, maybe psychiatrists as well. To be clear, psychologists in Canada cannot prescribe medication yet. But too many doctors may be prescribing these medications without enough knowledge of the side effects, of the counterindications. What they're doing basically is oftentimes going by what is the sexy drug of the month. This is what the drug reps are pushing. They're giving them thousands of free samples, and they tell them, to try it with their patients. And now, any of my patients who's on an antidepressant these days, again, depending on what's sexy at the time, I can usually tell them what medication their doctor gave them because it's always the same thing at that time. The problem is, beyond all of what I just mentioned, research over the last couple of years is clearly showing these days that for mild to moderate levels of depression, antidepressants don't seem to have any chemical effect. It's not affecting the neurology or the neurotransmitters enough to make a difference. So any improvement in the person's mood might either be the passage of time or a placebo effect. Basically, there's no real effect, but they psychologically feel better, they think they're getting better, and so they do actually end up doing better. Okay? Now, the question is, how do you define moderate depression? We have inventories and tools and so on, but this is all very subjective. The experience of depression really is person by person a type of account. So for some people who may have what they consider moderate levels of depression, maybe that's on the borderline of severe. And again, how do we even know what moderate versus severe is in the research? So I'm not saying that if you have moderate depression that you shouldn't take medication necessarily. What I'm saying is that you should be well aware of the side effects, do your research, don't assume that the doctor, whether it's a general practitioner or even a psychiatrist, don't assume that they necessarily know what is the best course. There's a lot of experimentation going on. It's just a matter of fact. And you will most likely end up changing your prescription a number of times, changing the dosage, maybe combining dosage, trying different types. And if you're with an ethical doctor, which I really hope you are, which in most cases will be the case, and a competent one, they will make sure that they work together with you, check on what's going on, and see what the best course is. Don't assume that, well, just because they told me to take 2 and call them in the morning, that this is going to be the right path for you. Any doctor should also, depending on the disorder or issue, they should make sure that there's some discussion about how you're going to wean yourself off of these medications at some point, if that's feasible. A lot of doctors don't even talk about that, and it can be a very difficult process for the person. So there should be a methodological approach. Too many people just stop taking them cold turkey. These drugs are so heavy that changing them all of a sudden can have a very negative effect on your mind, your mood, your body, your brain. So you have to be very careful that you deal with these medications not like you're popping a couple of baby aspirins, but that you are taking some serious psychotropic medication. I'm going to have more to talk about with regard to medication in the next video.